My name's Kelsey Cook. We're going to do part 2 of my physical assessment. So now we're back to my patient, Lexi. I'm going to have you lay back down. We just went over the 5 heart points. So we did the aorta, the pulmonic, the herbs, the tricuspid, and the bicuspid. So now I'm going to palpate, see if I can feel any kind of thrills over those points. So I'm going to palpate the aortic. I don't feel anything, and I'm going to the pulmonic. I don't feel any thrills or anything. Now I'm going over the herbs and the bicuspid and the tricuspid. And I don't feel anything, so she's good, no thrills. Now I'm going to have her sit back up and down, and I'm going to check her jugular pulses. So. Right in the rhythm, feel normal. That's good. Okay, now I'm going to inspect her abdomen. We just did her chest, so now we're going to go to her abdomen. I'm going to go ahead and have you lay down again. I'm going to check the color and the symmetry and all that. So I'm going to just pull it up. You have a shirt on underneath, so you're good. Okay, so the color looks good. Some freckles and some moles. No other discoloration. All the moles and stuff look good. It's pretty symmetrical. No masses or anything. So now I'm going to listen for the aorta and see if I can hear that. Okay, everything sounds good with the aorta. Now I'm going to auscultate all 4 quadrants, see if I can hear vowel sounds, which I think I might. I already heard some. There's some vowel sounds there. There's some there. There's some vowel sounds there. And got vowel sounds there. Okay. Next, we're going to percuss all 4 of those. See if we hear any kind of dullness or anything like that. So. Everything was good there? Okay, now I'm going to palpate, see if we can feel any masses or anything like that. So I'm going to push down, okay? Tell me if I hurt you, if you feel any tenderness. No tenderness there? Good. All right, everything was good. No tenderness, no masses or anything like that. So now I'm going to have her sit back up. I'm going to check her back out a little bit. I'm going to check her CVA, so it's going to be her flank area. I'm going to percuss there and see if there's any pain or anything with that, okay? Any pain or tenderness? Okay, everything felt normal. She didn't feel anything. Now I'm going to check her upper extremities, so her arms. I'm going to evaluate them. Got some freckles. Everything looks good there. Her skin is dry, not too dry. It's not wet or clammy. You don't want that. Everything looked good. Okay, next I'm going to check her fingers for her capillary refills. Okay, those refilled within a second. Good, those refilled within a second too. That's great. Now I'm going to check both of her radial pulses, make sure they're equal. Are equal. Perfect. Good job. Thank you. Okay, now I'm going to have her do range of motion with her arms and her hands. So just do this, 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 this. Everything feel good? Push your arms out. Arms up. Good? No difficulties there? Awesome. Okay, so now we're going to do her upper extremities for strength. So what I'm going to have you do? Push your arms out. Push against mine. Good. Okay. Now, like this, pull against them. Good, perfect, pretty strong, that was great. So now we're going to do her touch sensation. So what I'm going to do with that, I've got a cotton ball, which is soft, and then I've got a paperclip, which is soft. I'm gonna have you close your eyes, and whenever I touch you with one of these, you have to tell me if it's soft or if it's pain, okay? Okay, perfect. That was great. All right, now we're going to do her cerebral function, see if she's good. I'm gonna have you do your finger touch. So just do this with both fingers, both hands. Good, she's perfect. That's awesome. Now we're gonna do the lower extremities. So her legs, lay down for me, please. Okay, we're gonna do the exact same thing that we just did with the upper extremities. So I'm going to check her skin. She's got some bruises there. Yeah, she's got some bruises there. Some hairy legs, but other than that, everything's good. Her skin is warm. Not cool to the touch or anything like that. So next we're going to check her capillary refills and her toes. And your toes are cold. That was within 2 seconds. That's good, probably because your toes are freezing. That was in 2 seconds. Good. Okay, next we're gonna do her range of motion. Go ahead and wiggle your toes back and forth. That's good. Okay, now take your foot in, bring it towards you, like this. No. Point it up towards you. Okay, now down. Okay, good. Bring your knees up. Good. Bring your other knee up. Good. Perfect. Everything looked good. Now I'm going to check her pedal pulses real quick. So, see if I can zoom in. Those are good. All right, let me check her anterior tibial pulse. Perfect. And now her popliteal pulses, which are behind her knees. That's perfect. Okay, now I'm going to stand at the end of the bed. I'm going to have you push against my hands. Okay, now pull. Good, good, perfect. That's awesome. Okay, next we're going to do the light pain touch and the soft touch. So you close your eyes. Just tell me what you feel. Awesome, good job, perfect. Okay, now we're gonna do range of motion of hips. So I'm gonna just have you pull your hips up. Okay, good. Now out. All right, now circular. Perfect. Okay, do the same thing with that. Up, and go out, and circulate. Good, her range of motion is perfect. Okay, so now we're going to do her patellar reflex and her Basinski reflex. So since she's laying down, I'm gonna go ahead and do her Basinski reflex. So what I'm gonna do, I'm gonna take it around here. Did it really work? Is it not tickling? Okay, with the Basinski reflex, our toes are supposed to spread out. Usually you think of Basinski reflex, you think of babies, because when you do that, their toes fan out. So, there's that. Let's just, all right, now I'm gonna have you sit on the side of the bed. Again. And I'm going to check your patellar reflex. Okay, scoot up just a little bit. No, back a little bit. A little bit. You know what that means? All right, that one worked. That one worked too. Perfect, good job. All right, next I want to do the Rombergers. So maybe stand up. All right, I'm have you put your feet directly together. All right, and close your eyes. All right. She's wiggling a little bit, but not too much. That's normal. So she's doing great. Okay, go ahead and open your eyes again. Next, I'm going to check your gait. I'm going to see how you walk. So if you can, just walk straight for me. All right, normal. Just gliding. She doesn't have any stutter in her step. Perfect. Okay, next, I'm going to have her, she's going to hop on one foot. Okay, so try that. Hop on one foot. Good. Okay, now do the other. All right. And that's the end of my assessment. Now, next what I would do, I would chart everything that I found. I would also obtain her vital signs, so her pulse, her respirations, her temperature, and her blood pressure. And that concludes it. Thank you.